Recently, UK universities called for universities to transform institutions into mentally healthy universities that place the mental health and well-being of staff and students as foundational for all aspects of the university system. Student well-being policy is a set of unique legislation and practices established by an education provider to give key mental and emotional well-being support for students. The policy is used to create a culture of well-being within higher education institutions. Let us see why a student well-being policy is important. First, it helps to cultivate a culture of well-being that prioritizes the needs of students. Second, a culture of well-being makes it part of the everyday life for students and staff, and it consists of a values-driven culture through the physical work environment and wellness programs. Third, it helps students get the most out of their academic experience and ensures that they can be provided with the support they need if they require it. Usually, a student well-being policy includes some of the following aspects: mental health advice, well-being advice and support, services for disabilities, career services, multi-faith support, peer-led support groups, financial guidance and resources, student health services, and staff support and well-being. Universities across Europe develop specific policies and relevant strategies aimed at fostering positive student well-being. Let us review some of their good practices. The well-being strategy of the University of Cambridge is designed to ensure clear leadership and management related to students' well-being. For that, there is optimal engagement of all stakeholders and effective partnerships. Available resources are used to optimize the delivery of the strategy, and actions lead to long-term sustainable improvements in the health and well-being of the university population. The integrated approach to staff and students' well-being creates a sense of belonging and an environment which is based on shared values and trust, and staff well-being is integrated into day-to-day practices. The strategy is implemented amongst engaging schools, departments, staff representatives, and other university members delegating various responsibilities. Such responsibilities include implementing safe systems of work to safeguard the health and well-being of employees. Responsibilities further incorporate reporting stress and illness to the management as early as possible, and the implementation and monitoring of workload in relation to health at work. The University of Crete Student Counseling Center has developed a set of practices in order to ensure its students' well-being, which include individual and group psychological support, early intervention, crisis management, prevention and raising awareness, for example, combating stigma, volunteering, support of students with special needs, liaison with community psychiatric and health services, seminars and workshops related to COVID-19 pandemic, for example, resilience building, Zoom fatigue, and social isolation. Recommendations: institutionalize processes for development and review of mental health policies, targets, and indicators related to student mental well-being. This should include data collection and analysis so that policies and actions are based on accurate and appropriate information based upon the needs, interests, circumstances, and health of students. Develop and support appropriate working groups, committees, and service providers and form strategic partnerships with mental health professionals, services, and advocates. Allocate appropriate funding for student mental health promotion and for support and recognition of academic work in enhancing student mental well-being. Consideration should be given to making training on mental health awareness and the protocols for reporting concerns available to all relevant staff. Develop an institution-wide understanding of mental health and well-being through professional development in mental health essentials. Recognize staff mental health literacy as an important element in supporting student mental health and well-being. Offer a personalized approach to student health and well-being support by making available a range of interventions to meet individual needs. Consult and collaborate with students' unions and associations, and particularly with students with mental health difficulties, when formulating and implementing student mental health-related policies and procedures, and in identifying areas for improvement. Enhance existing and develop new peer support programs across higher education institutions to facilitate health and well-being related conversations and activities. Institutions should consider the applicability and implications of their student mental health-related policies and procedures in respect of arrangements with collaborative and other partners such as further education colleges, placement providers, and employers.